Doctors Without Borders has taken the decision to suspend operations at Bashair Teaching Hospital in Khartoum, Sudan. In the 20 months since the organization has operated in the hospital, there have been ongoing attacks on patients and staff. For an in-depth discussion on this, I'm now joined by senior humanitarian specialist at Doctors Without Borders, Michiel Hofman. A very good afternoon to you, Doc. Thanks very much for your time. Perhaps before we get to your decision to suspend operations at this hospital, paint a picture for us of sort of how things have been at this particular hospital in the middle of this, shall we call it, forgotten war in Sudan.
Yes, I think that's very appropriate to call it a forgotten war. The war started indeed 20 months ago, and it started in the capital, Khartoum. And the fighting since in those 20 months has never stopped, not a single day. So the population, the remaining population in Khartoum, and a reminder, it was a city of around 10 million people. And we estimate there's still 3 to 4 million people that live in Khartoum. And they have been subject to continuous fighting, airstrikes, shelling. And that's why this teaching hospital, which was the only remaining hospital that was able to offer surgery, especially for war wounded, free of charge, why the closure of that now, when the fighting is still ongoing, was such a tough decision. So the people in Khartoum, especially the ones that have been stuck in the parts of Khartoum that are controlled by the Rapid Support Forces, have seen almost no delivery of any kind of humanitarian assistance whatsoever. The front lines have remained closed for more than a year, and it has been very, very difficult to reach, which is why the facility of Doctors Without Borders was one of the few medical facilities of a public nature where people could get these services free of charge. And we are afraid with our departure yesterday that a lot of those services will no longer be available for the population of Khartoum.
I mean, during all the chaos and the fighting and the shelling and everything, no humanitarian assistance. But during this period, over the past 18 months or so, have the warring parties at least respected the hospital? In other words, sort of kept away from them, allowing you, Doctors Without Borders and whoever else there, to at least treat the patients? Has there been that respect at least?
Well, only in the sense that both parties, so the Sudanese Armed Forces and the Rapid Support Forces, have continuously pledged that they would respect the neutrality of the hospital, and as such, it has never been hit by airstrikes or shelling. But the biggest problem is the behavior of the armed forces on the ground. So, despite continuous reassurances from the Rapid Support Forces, and a reminder, this area of Khartoum is controlled by the Rapid Support Forces, so it's their responsibility to make sure that armed men do not enter the hospital, has regularly been violated. And after each incident, the RSF pledged to improve the situation and have better control over their troops. But the reverse actually happened. The incidents increased in frequency and also in terms of violence. And what was the final straw for us was on the 18th of December, where not only armed men forced themselves into the hospital, but actually directly threatened health staff and actually shot some gunshots at some of them. And we consider the staff lucky and ourselves lucky that in the end nobody was injured or killed. And then we came to the conclusion that we cannot ask our medical staff to work under conditions where on a daily basis their life is being threatened, and these threats are also carried out. So that in the end meant we had to take this hard decision that it's impossible to ask our medical staff to continue to operate in that environment.
Previously, before what happened in December, did they guarantee and facilitate the safe passage of doctors in and out of the hospital, as well as medicines and equipment?
The safe passage and the guarantees that they would keep the hospital free of any weapons or any armed man inside the hospital has been given continuously. By and large, the movement of our staff has been respected. There were some incidents in 2023, so really at the start of the war, where in crossing the front lines there were some incidents, but that hasn't been the biggest problem. We of course accept that it's an active war zone and there are certain risks that we as an organization and the staff that we employ would accept that comes with working in a war zone. But what has never been respected is that medical staff cannot be forced to treat patients or to give preferential treatment to patients by force of guns. So these type of incidents have occurred during the 20 months, but escalated into actual violence directly, including gunfire against our staff in December. And it was always clear, also in our discussions with the Rapid Support Forces, that this would be an absolute red line for us, and that's why we had to take this difficult decision.
What will need to happen for you to lift the suspension?
We came to the conclusion that the only thing that seems to give sufficient protection to our medical staff is the presence of international staff in the hospital, because the problem is that for any of our Sudanese colleagues, they are continuously accused by the RSF of spying for the other side, and vice versa. So the presence of international staff is absolutely crucial and has proven to be the one factor that would maintain an acceptable level of security. So we have resumed our negotiations in Port Sudan, because the staff would have to come across the front line from Port Sudan. That is the only, geographically speaking, the only option to reach Khartoum. So if we get permission to bring staff and supplies in directly across the front line from Port Sudan, including international staff, then we would hope to resume medical activities.
But what will be the effect, the net effect of a continued suspension, including the possibility, of course, of closing down completely?
Yeah, that is to be seen in the next few days. There were some critical functions in the hospital, like the pediatrics department for complicated pediatric ailments. As I mentioned, the surgery, especially for the war wounded, but also the maternity services, especially for complicated cases. And at this stage, we have no view yet what type of services the local Ministry of Health will be able to continue after the support of Doctors Without Borders has been withdrawn. So we hope some services will remain, but we are pessimistic that some of the more specialized services will be able to continue, which would mean, especially for the population in South Khartoum, in the area under control of Rapid Support Forces, that access to specialized care like surgery or complex cases in maternity or pediatrics is likely to be no longer available free of charge.
Generally speaking, what has been the impact, of this war, especially or particularly as far as the health of the 10 million people there is concerned? All of this, of course, while the world is looking the other way.
Yes, like I said in the beginning, 10 million was the original population. The estimation is now that anywhere up to 4 million people are left, but that's a huge population still, of course. But the impact will be huge. Most of the health system has completely collapsed, especially in the areas under control of the Rapid Support Forces. So there's very few of the public health services available anywhere. And especially specialized services that needs specialized staff and surgeons and doctors to provide this. Most of them have gone. will no longer be available except for a few private hospitals, but that's of course just for the lucky few because they will charge quite a lot of money for any of those services. If nobody is there, it's difficult to know what are the figures. But for sure, if these type of life-saving services are no longer available, then a lot of additional unnecessary death will continue to occur.
Dr. Hofman, let me thank you very much for your time. Dr. Hofman, of course, following that decision by Doctors Without Borders to suspend operations at Bashair Teaching Hospital in Khartoum, Sudan.